Today, I'd like to talk about a question that many of my patients are asking me in the wake of the COVID pandemic. Is it safe to return to chiropractic care? The last 2 years have caused significant disruption to many of our daily movements and our patterns. The workplace has forever changed for many of us. COVID is still very much within the community. Most of us will have either been infected with COVID or will know someone who has and had that impact our lives quite closely. We still have the impact of it on our health system. Just a couple of weeks ago, the entire state of Queensland restricted elective surgery on the basis that there simply were not enough intensive care beds available to deal with an anticipated spike in COVID cases. The risk of new strains is a constant spectre, and I think beyond that it's worth considering that we now have a global community which is much more sensitive to the potential for future outbreaks of new viruses. So what does all of this mean for the Ashgrove Spinal Centre and the practice of chiropractic? Firstly, we monitor government health department and professional association updates on what constitutes safe practice. This is determined by perceptions of risk, what the current strategy with managing coronavirus is within society. It's safe to say that over the period of the pandemic, the strategies that we were using to combat it evolved and changed, and sometimes this made a lot more sense than others, but what was certainly in place was that there was an overall plan to manage the pandemic. So in applying these safety practices and the current school of thought with respect to dealing with COVID to a patient-focused, low-volume practice such as mine at the Ashgrove Spinal Centre, let's talk about what that looks like. Firstly, if you are COVID positive, if you're awaiting a test result, or you're showing obvious signs of potential COVID infection, these include fever, cough, tiredness, loss of the sense of taste or smell, headaches, a new headache specifically, a sore throat, new aches and pains, then it's probably best to advise us and not attend the practice. This will reduce the chance of you contaminating other patients while they're in the practice. Additional hygiene measures have been taken within the centre to ensure that in potentially infected individuals who may be asymptomatic don't contaminate surfaces within the practice, which can then be contacted by other patients and create the potential for the virus to spread. The use of masks. Currently, we are not mandating the use of masks. This is in accordance with the directives that we're being advised. However, rest assured, we don't object to patients who choose to wear a mask or rule out the potential to reinstate masks in the future as directed by Department of Health recommendations, mandates, and of course the recommendations of professional health associations. Social distancing. Social distancing has changed the way we set up our waiting room and the way that we run the practice. During the COVID pandemic, we asked patients to wait out front and then be brought into the practice. This is not in place at this point in time. However, we have rearranged the practice waiting room such that people don't end up sitting next to others, allowing them to socially distance. You may remember the train set. We had a train set for years. The kids used to love playing with it, and to be completely honest, the adults used to enjoy playing with it if they didn't think anyone was looking. That has actually gone. The simple fact of the matter is the risk for cross-contamination and for that as a hotspot of COVID infection, it was just too great. So unfortunately the train set has been removed from the practice. Clear and accurate communication about immunisation, specifically COVID immunisation. There is no credible evidence that chiropractic treatment, be that spine manipulation or another modality used by chiropractors, has any impact on an individual's immunity that would make them less likely or protect them from COVID contamination. Quite frankly, the suggestion that this is the case, it's bullshit, to be completely frank. So it's important to maintain that. We maintain that people should follow the immunisation guidelines. Immunisation is a public health decision, and therefore it needs to be done at a public level to have maximum effect. So if it keeps you safe, it keeps our families safe and each other safe. I'm confident that these strategies will allow everyone to safely return to chiropractic care, and I look forward to seeing you in the future. Thank you.